Hi, good morning Nessie. My name is Charlie Hooper. I'm your invigilator for the OET speaking session on the 14th of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Nessie Jordan.
And what is your candidate number, please?
My candidate number is 215252120.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Have you ever felt dissatisfied with your work as a nurse?
I once became extremely dissatisfied. It was because I was consistently being given easier assignments and not being given the ICU-level patients. It became frustrating. Meanwhile, I understood that others needed to learn and gain experience. It quickly left me annoyed with my position, the unit, and the healthcare system. I sat down and spoke to my nurse manager about my concerns, and inquired why it was happening. The nurse manager was not aware of the situation. And it was later determined that a few of the charge nurses were giving the sicker patients to their friends, and not spreading them out amongst the nurses.
Describe a time when you went over and above your job requirements.
I personally feel like I give 110% to all of my patients every shift. But there was one that I grew especially close with. For some reason, the patient had been dropped off by a family member, and no one had come to see the child for months. It was obvious the patient was missing key developmental milestones, and was becoming increasingly lonely and depressed. I asked to become the primary nurse for the patient, which meant, every time I worked he would be assigned to me. I worked with him over several months, to get him trained and to improve his vocabulary. I don't know exactly why I was extra motivated, but at that time, in our lives, the patient and I needed each other.
Give an example of a mistake you've made.
Mistakes are part of nursing, whether we like to admit to it or not. It's important to learn from those mistakes and become a better nurse. One mistake that I will never forget is leaving the gastronomy tube unclamped with medication administration. Because it was unclamped when I opened the port to give the next medication, the last medication, as well as formula, came out. I was unable to clamp it quickly enough, and the medications I had already given were leaking onto the bed. I had to speak with the medical team and pharmacy to discuss replacing them. I have never forgotten to clamp the gastronomy tube again.
Give me an example of an awkward situation at work.
I once had a teenage male patient who made very inappropriate sexual comments towards me. At first, I ignored them, thinking it was a one-time thing. The second time, I told him that the comments were inappropriate, and I did not want him to say those things to me. The third time, I left the patient's room and went directly to the charge nurse. I explained the situation, and how uncomfortable I was in that specific situation, and caring for the patient. She gathered a team to speak to the patient. My assignment was switched for the remainder of the shift.
Tell me about a time you were under a lot of pressure.
I was the most senior nurse in the unit by over a decade. I had to not only handle my patient assignment, but I also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning, Charlie Hooper. My name is Nessie Jordan. I am one of the registered nurses working in this clinic. How are you today?
Good morning, nurse. I am good. Thank you for asking.
Charlie, your doctor has referred you to visit the clinic. Am I correct?
Yes, you are correct.
I can understand your situation. Don't be nervous, Charlie. Your doctor has informed us about the reason for your visit. We are here to help you. Just relax.
Yes. Okay.
Do you have anything to say, Charlie?
Nurse, I am very unsure about getting my problem fixed.
First of all, Charlie, you should realize that your condition is a common problem among children of your age. And I can assure you that bedwetting can be fixed if we are adopting some appropriate measures.
Okay, nurse.
Charlie, before proceeding further, I would like to ask you a few questions regarding your condition. So please feel free to talk to me.
Okay. I will.
May I proceed, Charlie?
Yes. You may please, nurse.
Before going to bed, did you usually take water or milk?
Yes, I do.
Can you say how much quantity you consume?
I usually have my dinner just before my bedtime. So it depends upon the food I eat.
Okay. I understand that. Will you find time to urinate before going to bed?
Yes, nurse, I always do that.
That's perfect. You should continue to have this habit.
Sure, I will.
Charlie, are you aware of the frequency of bedwetting?
Unfortunately, I am not.
It's okay, Charlie. And when will you realize you wet your bed?
Nurse. It's been only identified when I wake up.
Thank you for the information. Don't worry, Charlie. I have got some ideas about the difficulties you face.
Thank you for your understanding, nurse.
Well, Charlie, may I know how your parents help you to sort it?
They gave me dinner early. But every time I had my dinner, I would fall asleep sooner.
That's okay. At your age, it's quite normal, Charlie.
No, nurse. It's my fault. I should have been more conscious.
Charlie, don't get disappointed. Just pay attention to me. I will explain to you the causes underlying your condition.
All right.
Charlie, you are not knowing when you wet the bed. That is just because you are having a deep sleep. You are getting a sound sleep. Which is a good thing. Isn't it?
Actually, yes.
Well, some other reasons that could cause the condition can be a small bladder. Bladder is nothing but a pouch that holds the urine. Are you clear?
Yes, nurse.
Good. You are a child who is in a growing stage, and you are not a fully grown adult. So, your bladder may not be developed enough to hold urine produced during the night.
Okay.
Or, it can be the inability to recognize a full bladder while sleeping. It can even be a hormone imbalance in the body, and so on.
Okay, nurse.
There is a simple technique we can adopt in this initial stage. I will provide you with a nasal spray. You should use it before going to bed. Will you be able to do it, Charlie?
Yes, sure.
Very good. And this spray will delay urine production at night, and will be functioning as usual when you wake up. That sounds great, isn't it, Charlie?
Yes. It will be a very helpful, nurse.
Also, Charlie, you should chart your urine frequency at night. That is, do the chart only if you wake up during the night to urinate.
Okay, nurse. I will do that.
I reassure you, Charlie, your condition is fully curable. Don't be disappointed. Be a smart boy.
Okay, nurse.
You should come and visit me next week with your chart. I wish you happy days ahead.
Thank you, nurse. That is the end of your OET speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.